Hey, my name's Dr. Robban A Sica, and I've been treating hypothyroidism in my integrative medicine practice for over 23 years now. And I can tell you it's one of the most powerful treatments that I have at my disposal. The way that I work in my practice is basically to look at what deficiencies are affecting the person, diminishing their reserves, and how many stressors there are in the system. And one of the most powerful, one of those profound ways that the energy level, the energy reserves in the body gets affected is if the person is clinically hypothyroid. Remember that the thyroid gland controls the metabolic rate in every cell in the body. So if the metabolic rate is diminished, then every single cell is going to be compromised. And when that happens, if it's an immune cell, the immune system is not going to be good, and the immune system is not going to be strong enough. And then the person's going to be more susceptible to chronic infections, to opportunistic infections, and even to cancer. In the case of fatigue, the cellular energy production is diminished in hypothyroidism, and so and that affects detoxification. It affects metabolism in a wide variety of ways. So by correcting hypothyroidism, by identifying and correcting hypothyroidism, we take a huge step toward getting the patient better. And the way that I do that is I take a very thorough history and look at all the symptoms and all the signs in a physical exam, as well as the temperatures and how their metabolic rate is, in addition to the blood tests. And I do not just a TSH level, I do a full panel of blood tests and thyroid antibodies as well. Now, a little caution about using the blood tests, solely the blood test, is that they will miss a certain percentage of patients. The lab tests do tend to underreport hypothyroidism. There's a wide variety of reasons why that is. The most significant of which is that we generally draw a full thyroid panel on patients who we suspect a thyroid problem, and yet our lab reference ranges are based on the last 100 to 200 samples submitted to the lab. So when you determine your reference range that way and you're testing on a sick population, you're not deriving a normal or optimal or healthy range. You're creating a reference range of at least partially sick individuals who may indeed have hypothyroidism. And that's one of the many reasons why the thyroid test can underreport hypothyroidism. When you get the patient, however, optimal on their thyroid and the metabolism is working properly, then it's much easier to implement other strategies, their allergies, getting their diet to be a healthier diet, detoxification, etc. becomes much easier. The person has more reserves with which to deal with stressors that are still existing, and they recover. And it's very rewarding to me treating thyroid patients because they feel so much better. And I can't even count the number of times I've had patients come back to me and say, I feel like you've given me my life back. I feel better than I felt in 20, 30, 40 years. And it's very rewarding as a physician to hear that, to really hear that you've changed someone's life, you've made a difference in their life.